honest answer is that no day is the same. Wishing that you could do so much more within your role, but being somewhat limited, whether that's by resources or time. Choose something that you're good at, something that you have the skills for.
Hi everyone, my name is Irene, and welcome to Oceanside Perspective's new series, Purpose, Why Medicine, where I speak to professionals in healthcare who have found their purpose and want to share their unique journey, experiences, and learnings with our audience. I'm here today with Dr. Brendan McIntyre, resident physician of emergency medicine in Los Angeles. Dr. McIntyre, thank you for taking the time to have this conversation with me today.
Thanks so much for having me on the podcast. I'm excited to chat today.
Yeah, I'm excited too. Let's start by talking about your personal journey to medicine. Could you briefly introduce your background and how you got to where you are today?
Sure. Yeah, I could say it was a bit of a journey to get to medicine. I was born and raised in upstate New York before heading to the Midwest for college, where I actually studied environmental sciences and global health. And during college, I really enjoyed volunteering in classrooms as like a teacher's aide, and had gone through college thinking I would probably go a PhD route and have a career in research and become a college professor. The PhD route didn't really feel right for me at that point in time, but I knew I was really passionate about teaching. And so I pursued a credential in mathematics right after finishing my undergraduate degree and moved to California, where I've been for the past 10 years. I spent those first 3 years as a math teacher for both middle school and high school classrooms. And then I had a kind of a point in my career when I was teaching where there's some restructuring going on, and I had to end up moving schools due to the closure of the school that I was at. And it was a good time to kind of think about longevity in my career and if I wanted to stay teaching or do something similar or what was next. And I had a background in global health and had been kind of connected to the healthcare system from a research perspective as an undergrad. But kind of had a beginning of a dream about what if I switched into medicine? What if I took this leap to something totally different? And I didn't have the full pre-med foundation given my undergrad focus. So I went back and did somewhat of an informal post-bac over about a year. I ended up doing some shadowing to kind of confirm that it wasn't just a dream and I really had a good fit kind of within medicine. And I did some volunteer and research opportunities as well. I ended up taking a huge leap in my career and applying to medical school and was really grateful to get in. And I spent 5 years in med school doing a combined dual degree with an MD and MBA. Wrapped that up about just under 2 years ago, and now I'm 2 years into my residency in emergency medicine. So it's been a bit of a long journey to get to where I am today, but it's been a really cool one, and it's a nice opportunity today to look back and talk about that.
Mm-hmm. Yeah, I always love to hear about the unique paths that people take to get to where they're supposed to be. A central theme for this podcast is purpose, or the why behind what you do. So I have to ask, why medicine and why not any other career?
That's a great question. It's somewhat of a hard question, but I think I have a good way to answer that. Um, the best advice that I got in pursuing careers that I actually got from a high school teacher was that in choosing your path and what you're passionate about, choose something that you're good at, something that you have the skills for, choose something that's needed by your community, and then choose something that brings you joy to do. And medicine is something that checked all those boxes for me. I think my skills kind of fit with what's needed on the day-to-day job, and I enjoy the skill set that I have to keep pursuing every day. It's really needed. We know that we spend a lot on healthcare in our country, but our outcomes are not where they need to be. And so there's a passion and a drive and a need to continue practicing medicine. And I think the last part, bringing joy, I get a lot of joy out of working face to face with patients, and also, seeing good outcomes, and also supporting families in patients when outcomes are not as great in emergency settings. Um, Something that you have the skills for, something that is needed, and something that brings you joy is really what I focus on when I make my career decisions.
Thank you for sharing. In preparation for our interview today, I actually went back to my notes from when we first met over Zoom in 2022. One thing that you mentioned was that you saw medicine as a parallel to teaching. How did your experience as a teacher influence the way that you see or approach the learning and practice of medicine?
That's a really good question. I I think back to teaching, and I think back to when I was a high school math teacher, and I had a class of 35 students, and um, I had a geometry class, for example, that had a mix of students who were a year ahead on an honors track, a mix of students who were right at appropriate level, taking geometry for the first time, and a group of students in the class that were remediating the class, taking it for a second time. And the goal was to get all students across the finish line and to meet the learning objectives. But in that class, you have 35 different learners, 35 unique individuals who are trying to interact with learning in a way that makes sense for them, based on what they've learned in the past, their foundations, and just also their unique approach to how they learn. Are they students who need to see things? Are they students who need to hear things? Are they students who need tactile projects to learn? And I think, comparing that to medicine, each patient, even though they might be presenting with a similar pathology, like a asthma exacerbation or something very serious like a cardiac arrest, this is an individual that's navigated their health and understanding and treatment of it very uniquely based on the resources that they have, the past experiences that they've had with healthcare, and their knowledge of how to care for themselves. And so I really view each encounter in the emergency department as working with a unique individual. This is not just so and so who's here with asthma. This is not just so and so who's here with a hypertensive emergency. This is a unique individual who I need to spend time listening to hearing what their experiences have been in the past with their conditions, what's worked for them, maybe identify areas of need or support that we can deliver in the ER, and sometimes having individualized conversations with family members to help develop a support system, whether that's a patient who's going to be heading home with a good discharge plan, or whether that's somebody who needs continued support while they're hospitalized. Medicine really takes a strong need for meeting individuals where they're at. I think we all kind of share similar experiences interacting with the healthcare system, but the unique needs that each individual has and unique treatment that each individual needs is going to take an individualized approach. And that really is, it's really important to get to know that individual patient and where they're at.
Yeah, that's really insightful. Um, so you pursued a dual MD MBA degree. What led you to do that, and how has earning your MBA influenced your perspective and growth as a physician?
So for pursuing my MBA, it's something that I think is a little bit of a growing trend for medical students. There are some MD MBA programs that are pretty formalized, and others that are just getting their starts at medical schools across the country. And I think the something amazing about them is that it can support you with training and a skill set that you just do not have an opportunity to really dig into as a medical student on a standard track. Um, as a medical student, you spend your time learning doctoring skills, learning patient communication skills, learning the ins and outs of physiology and pathophysiology. And you end up leaving medical school with the foundations to be a great doctor who can communicate with patients, understand diseases and how to treat them. But what our medical education could really benefit from is a systems understanding of what you're working within, which is this broad, massive, complex healthcare system that has a lot of strengths, has a lot of weaknesses, that operates within a really complex framework of not only regulation and policy, but also insurance structures, And pursuing an MBA really gave me kind of a concrete skill set to understand how business affects medicine and how, in addition to those one-to-one patient interactions that can be really impactful, achieving change on a systems level can also be immensely impactful. And to make that impact, it takes a good understanding of how our system works and what are the factors that drive change in the healthcare system. So I think getting an MBA gave me kind of a foundational start to trying to approach some of those questions. I don't think that an MBA is 100% necessary to make change at a systems level in medicine. There's so many different ways that physicians can do that, whether that's similarly pursuing a dual degree like a master's in public health and being a researcher, or a PhD and really driving change through research discovery, or even just being a physician who uses your platform and your voice to highlight causes that really matter, or to take their lived experiences and write about them, or to share about them on podcasts, for example. There's so many ways to make a difference at that systems level. But for me, I saw the MBA as a chance to really get a concrete skill set that I didn't have. I think within emergency medicine, I'm interested in using my MBA to eventually do a medical director position. So, in addition to doing clinical work, um, doing some administrative work within an emergency department to help improve patient outcomes, and that is related to doing quality improvement. It's related to looking at throughput in the emergency department and how can we better serve patients more efficiently and get them the care that they need efficiently. I don't know exactly what that path looks like just yet because I'm so early in my career, but I'm excited to kind of have that extra skill set to make that impact.
Yeah, thank you for sharing. I think one of the things that really interested me about medicine was its intersectionality. I think you can connect it with so many different fields, whether it's law, policy, it's education, or as you said, with leadership and administrative things. And there's just so many ways that you can make an impact adjacent to clinical work.
Yeah, definitely. It's something where everybody's path is going to be different, and some people drive or some people get most of their joy out of that 100% clinical work. Others find kind of a niche area that adds a different perspective to their career. And I think one of the coolest parts of medicine is that when you enter medical school, you don't know exactly what path you're going to go down. You might have a good idea, but it's been really cool to see so many of my peers not only find their specialty, for example, but also to find ways that they are making a difference outside of the clinical sphere.
Mhm. So, moving on to some advice for aspiring physicians. How does someone know that medicine is the right path for them?
That is a really, really tough question, but it's a great one. Um, I think similar to other careers, it's something where you really feel a calling towards it. You feel a really strong pull, and it feels like beyond anything else in your life, that's what you're meant to do. And that's not to say that people who enter medicine couldn't find joy or happiness in other routes. For example, I do have friends who initially applied to medical school, but they found their niche, for example, in biotech. They Some who career switched, others who ended up applying and did not get into medical school, ended up taking a different route. Um, I think as far as how if you know medical school is right for you, it takes a lot of exploring. I think some of the things that helped me were to talk with actual medical students, with residents and physicians to figure out, what life looks like in that career and that specialty, and is that a good match for what I'm looking for. I think there's also a process of exclusion. I was talking about how I had peers who thought medical school was what was right for them, but end up in a different career, and that came through also exploring other options and saying, like, do I want to work more clinically? Do I want to be more of a researcher? Or maybe I want to work more in a private sector setting and drive change related to medicine through innovating with a specific product. It's it's really such a different path for everybody. But I think in a very long-winded way, it's that gravitational pull where you feel like nothing else is what's right for you. And it's something that I think you really need that pull to and that drive to persist throughout what is a really difficult training. Um, Medical school and residency have kind of unanticipated challenges, and it's a lot of time investment. There can be a lot of stress. There can be a lot of sacrifices or deferred gratification in terms of scheduling your life to really make sure that you can commit to it. And I think that drive and that purpose is what, for example, looking back on my journey has been what's driven me for the last 7 years. There's been so many unanticipated challenges, but also so many triumphs and great moments. But it all comes back to that purpose and that drive to do what you do every day.
So, I've heard from many different people how challenging med school applications are, and it's only going to be more and more challenging as the applications increase and the med schools. There's only so many med schools. So, what qualities or experiences do you think med schools are looking for today that might set an applicant apart from the others?
That's a really good question. In terms of qualities or experiences that medical schools are looking for, I don't think that there is one specific set or one specific type of person that medical schools are looking for. I think medical schools are really looking for individuals who have proven their passion and taking their unique lived experiences and found ways to use those to motivate them to make a difference in medicine. I think there's a growing trend as well to recruit physicians that reflect the diverse population that we serve in medicine. I think there is a growing emphasis on diversity, equity, and inclusion, and that's been really awesome to see. Throughout my short career in medicine so far. Um, I think that the best advice that I could give to pre-med applicants is to really be you on your application. And when you're choosing to pursue volunteer experiences or choosing to jump onto a research project, make sure that those are things that actually really excite you, whether it's having a chance to serve a population that reminds you of your roots or reflects your identity, or if you're passionate about a specific social cause, getting involved in a project or a volunteer experience related to that true passion and true match for the activities that you're pursuing is really going to come across on your application, as compared to approaching the medical school application like checking boxes. Oh, I have to do volunteer work. I have to do research. I have to shadow. Really making sure that the experiences that you choose mean something to you, and there's something that you're really passionate about. That's really going to come across and help show the unique you when you apply.
Mm-hmm. Yeah, it's really helpful. Um, I'm planning on applying next cycle, so just getting all the advice and going to try my best.
Yeah, and I think that what you said, getting all the advice, is a really great note. Just remembering that there are so many people who have gone through that process before you, and that you're not alone. And finding mentorship, reaching out to those who've been through it, I think is one of the best ways to get the right advice. And there are certain things that are kind of more algorithmic in getting ready for med school, like that you have to take the MCAT, and that it's a long process of studying, and there are pretty structured plans of advice that people could give on how to prepare for the MCAT, for example. But as far as the other parts, making sure that you can find a mentor who kind of like clicks with you and can talk with you about how your personal passion for medicine is going to come across as you apply. Having somebody to kind of explore to explore your resume and research experiences and volunteer experiences with somebody who really knows you and can advocate for you. I think finding that fit is important. I think some people find that fit in terms of talking to like professors at their undergrad, others through a career center. But talking to somebody who is a couple of years ahead in medical school, I think is another great way to really get an idea of what it's like, and not only the application journey, but also the beginning of medical school.
Yeah, it's been very helpful, whether it's through this interview series or from personal network to speak with these professionals and those who have gone through this whole journey. So, in terms of choosing a specialty, what drew you to emergency medicine specifically, and why did you choose to specialize in it?
Yeah, that's a very good question. Something that I'll comment on before I answer for myself is that roughly half of medical students enter medical school knowing correctly the specialty that they want to pursue. And half, and possibly slightly more than half, end up in a specialty that they did not anticipate. And I think the best piece of advice I have for choosing a specialty is really keeping an open mind as you navigate through medical school. Um, Me personally, I wasn't 100% sure what I wanted to specialize in when I entered medical school. I had really broad interests, and I was like, I really enjoy parts of primary care. I really enjoy parts of surgery. I really don't know, and I felt so undecided, which was kind of nerve wracking when I had so many friends around me who entered and said, "Hey, I know I want to do this," and had such a direct path to doing so. But I think keeping an open mind was really helpful. It helped me to really get the most out of my clinical rotations as a student. So, for example, in my third year of medical school, I rotated through all the core specialties: internal medicine, general surgery, psychiatry, OBGYN, pediatrics, neurology. And going through the year, I wasn't sure what I was going to do in terms of a specialty. And that helped me to kind of approach each rotation with like a blank slate and an open interest, and to try to see what might be a great fit for me. I think towards the end of my clinical rotations of my third year, when I got to planning my fourth year schedule, I had to kind of make a decision between if I wanted to do something surgical, or if I wanted to do a field that was not purely surgical, but I knew I liked procedures. And emergency medicine was a rotation that kind of unexpectedly blew me away, where I showed up to each shift and no shift was the same. Some patients came in uh, with traumatic mechanisms of injury. Other patients came in respiratory distress. Other patients came in with more urgent care needs. But I found it really fun to be able to like take each patient as they came through the door and to try to uniquely figure out, what brings you here today? What can we do to acutely help you? Um, Sometimes that was really evident, and other times it was like a really complex jigsaw puzzle to figure out why somebody was presenting with abdominal pain. And I found that the breadth of medical knowledge that was needed and procedural knowledge with all the procedures that are done in the ER was really fascinating. And I also really enjoyed that you could treat any patient that came through your door, and that include patients of all genders, all different personal backgrounds, all different ages, and I knew that there was something that really just felt right. Um, and so I was really excited to kind of find that match in emergency medicine, and I confirmed that by doing additional rotations and getting some career mentoring in the fields. And I haven't looked back since. I'm nearly 2 years into residency, and it's been a really cool journey to kind of take that initial interest and to keep building the skill set within emergency medicine.
Yeah, that's amazing. What advice do you have for med students who are going through that process of choosing their specialty and applying to residency?
Yeah, I think it reflects back to even some of the advice we talked about for pre meds, and it's really finding somebody who can chat through your personal experience with you and who can mentor you. When I was making my decisions between specialties, there were a couple that was considering, and I scheduled meetings with both residents and with attending physicians in those specialties and kind of chatted both about what training is like, what's your day to day like, what is life like beyond residency, what do you really like about the career, what are some of the drawbacks that you've experienced, in terms of, is it work hours, is it scheduling, are there certain things on the day to day job that you didn't expect to have to do that aren't the best fit, and asking some of those tough questions, because every career, no matter what you're in, is going to have great pros and also have some cons as well. And asking some of those tough questions, I think really helped me to kind of find my fit. With emergency medicine specifically, there are certain things that I really like. For example, like the shift work. I like working a mix of afternoon shifts or evening shifts. I like that, sometimes I'll have random Tuesdays and Wednesdays off, and sometimes I'll work a weekend, and other times I'll have, a bunch of days off in a row that is not really a 9 to 5 type schedule. For others, they might like emergency medicine, but the idea of not having a clinical schedule or a 9 to 5 schedule might be a deal breaker for them. And so asking some of those questions, beyond just, do I like doing this work, but is this the right fit for me? Is this the right role for me? It is really important to ask the people who have been through it. I think a big decision that a lot of medical students make first is, do I want to do something surgical, or do I want to do something non-surgical? And there are a lot of non-surgical careers that do end up having procedural components. For example, if you do internal medicine and then go to GI or cardiology, you're going to be doing a lot of procedures. But that comes after, your foundational residency years of doing internal medicine, where you're really, operating more on the wards and not doing as much procedurally heavy work. But I think that distinction, do I want to do surgical training or do I want to do something non-surgical, is kind of a good place to start. And then from there, within surgery, there are so many different fields. Within the non-surgical specialties, there are so many different fields as well. But that distinction, I think, is something that, going through your third year rotations, students can figure out, do I love being in an operating room? Do I love doing procedures? Or do I want a career that's less heavy on that kind of technical training and is a little bit more cerebrally focused? And you don't know what that's like until you get there and you're actually in the OR scrubbed in and having those experiences. So keeping that open mind as you navigate through medical school, I think will help you figure out what's best for you when you get to that point.
Hey, so a little break from our conversation. Oceanside Perspective is a 501c nonprofit dedicated to human skills education. So we would appreciate any support from you, whether it's liking this video, subscribing to this channel, or subscribing to our newsletter below in the description box. Thank you, and let's get back to our chat. In one of my first interviews, one of the pieces of advice that really stuck with me was stay curious and basically go into everything with an open mind, as you said, and just, learn what you can. And I think things will just fall in place usually.
Also taking the time to really, ask those questions along the way. And when I went through my rotations, in addition to trying to learn the foundations, for each of those rotations, each resident or attending that I worked with, I would kind of quickly ask, like, when timing was appropriate, like, what led you to go into neurology? What led you to become a urologist? What about pediatrics drew you to the specialty? And kind of hearing the unique responses from each person, it was a way to kind of assess, like, my fit and if I felt similar draws, like, to that specialty itself. And if you kind of do that each day with each team that you work with, going throughout your clinical rotations, you'll get a lot of perspective. And it's cool also, even if, for example, a specialty doesn't doesn't really fit with you to learn why it fits for somebody else and why they're passionate about it.
Yeah. So, moving on to your working life as an emergency medicine resident, what does a typical day in the life of an EM resident look like?
I think the honest answer is that no day is the same being in emergency medicine. But first, in terms of the scheduling, for a lot of emergency programs, you'll have a balance of day shifts, a balance of swing shifts, which start in the afternoon and end um, maybe just after midnight. And then you'll have a mix of night shifts as well. And so a third of the time I'm working those day shifts, a third of the time I'm working swing shifts, and a third of the time I'm working night shifts. And our schedule kind of follows a circadian progression. So you won't, for example, be going from a night shift one day into a day shift the next day. You'll kind of have typical shifts grouped together. But each week looks different. I might be working more nights. I might be working more days. I might be working the whole weekend and have a Tuesday and Wednesday off. I might have what we call a golden weekend and have the whole weekend off. No week is really the same. And no shift is the same either. They follow a similar structure where at the beginning of the shift, we will sign out the board from the previous team. There are always going to be some patients that are still have things pending on their workup, whether that's CT imaging, whether those are lab results, whether that's reassessing pain or a clinical exam. And we will start the shift by hearing about those patients, and then we will start to see new patients as they come through the door, either walk-ins or ambulance transport. And what we see in each shift changes every day. I've had shifts where there are multiple cardiac arrests and you're running codes for the majority of your shift. I've had ones where they're more heavy with traumas that come in and having to do a trauma survey and work with some of our peers, the trauma surgeons, to figure out a disposition for the patient. And then I've had other shifts that the chief complaint is different for every single patient that I see, and so it's a bit of a moving target with what each day looks like. The the essentials of our job in emergency medicine are being resuscitationists. So any critically ill patients that are coming in, our goal is to resuscitate them and to stabilize them so that they can be admitted to an appropriate service, whether that's cardiology, whether that's internal medicine, whether that's a surgical service, and a patient needs to be emergently transported to the OR for a procedure. We also interface with a lot of patients, the majority of which aren't admitted and come in with an acute complaint that we have to treat and stabilize and help the patient determine a long-term plan for follow-up, whether that's getting an appointment scheduled with a specialist, whether that is meeting with their primary care doctor. So every day is quite different, which can make it challenging in some ways, not knowing what's going to come through the door. But it also makes it really exciting. You never know what work is going to look like when you show up. Some days are very calm, and other days are not so calm and very chaotic, but there's never a dull moment. You get to see a broad spectrum of pathology and different diseases, and you also get to do a large number of procedures. For example, doing intubations in the emergency department, getting central venous access. In traumas, there's a lot of procedures that we do to kind of stabilize patients as well. So no day is the same.
Mhm. What would you consider to be your favorite or most satisfying part of your job?
I think the most satisfying part of my job in emergency medicine is that there's something that drew that patient to come to the ER that day. And for many patients, being in the ER is a really tough experience. There's some intense pain or there's fear of some symptoms that they're having. Or it's a chronic condition that they really know intimately that needs stabilization. And with your skill set in emergency medicine, you can, in a really short period of time, try to make a meaningful difference for that patient, whether that is getting them admitted to a hospital and connected to specialty care, whether that's educating them on, chronic illness and how, um, adherence to their medications and follow up with primary care can really help them, navigate their illness, or whether it's something as simple as, somebody needs some stitches and you get to just get that done for that patient and get them home and get them healing. You get to make a big difference in a short period of time. I think the flip side of that is that we, in the emergency setting, don't have all the time in the world and all the resources in the world. And so sometimes there's imperfect solutions, or a patient, for example, is navigating um, an illness that requires a lot of long-term management, and there might be barriers to getting that access to care. And so you also see patients come in with needs that you can't address, which can be tough and kind of cause what we would say is moral injury. Wishing that you could do so much more within your role, but being somewhat limited, whether that's by resources or time. But you do get to make a big difference in a short period of time, and uh, for some patients, that can be on what's the worst day of their life, like being in an ER. And the outcomes are not, always satisfying, but a lot of times they are. And even at times where you have to give a difficult diagnosis, or you are helping, for example, a family experience loss when a patient comes into the ER and passes away, you can still be there to support a family and to give resources to that family or that patient. Um, so you never know what's going to come through the door. You never know what your day is going to look like, but you know that with your skill set and experience, you can make a difference for that patient or their family.
Thank you for sharing that. Lately, there's been a lot of discussion about physicians dealing with burnout and the importance of work-life balance. According to an article the Wall Street Journal published a few weeks ago, younger doctors want more reasonable schedules to accommodate life outside of work, and many older doctors stress the value of these additional hours for training, experience, and stable patient care. What's your perspective on this topic, and how do we bridge this generational gap?
I think burnout is a huge topic of discussion in healthcare, especially in emergency medicine, which can be a very stressful career and has some of the higher burnout rates among specialties. Um, I think burnout is multifactorial, and it's going to be unique to that physician. A lot of the drivers or factors that contribute to burnout are similar. I think they can be um, things related to physical health, like not getting enough sleep, not getting enough nutrition, not having a chance to exercise appropriately, or feeling like you are um, investing so much time in your career that it detracts from your personal life, from your time with family or with friends. And for as far as burnout too, I think there's also a layer of what I kind of mentioned before is moral injury. For me, a big source of burnout on my shifts is those opportunities where you want to do so much more for a patient, but realize within the time and resources that you have, you can't do everything that's needed to make that difference for that patient. Um, because the patient might not have insurance and needs to be connected to follow up, or possibly because the patient needs more social support and getting them to their appointments or helping them manage their chronic illness. I think burnout for me is it's something that I try to prevent by taking care of the essentials first. Sleep is a huge thing for me. Regardless of what most people have read or heard about, most of us do need 7 to 8 hours of sleep a night, and we there's a fraction of the population that can do well with less sleep, but for me, getting enough sleep is so essential to being able to show up to work and to show up 100%. And so when I have night shifts, for example, that includes scheduling time where I might have to sleep in until 4 p.m. or so the next day. making sure that I can be rested to show up for my shift. Um, I think preserving a couple hobbies that you really care about going through residency is important. Um, one of those for me is weightlifting, another is running, and I make sure to kind of schedule those things in. Um, and then maximizing your time off to plan in advance, whether that's travel, whether that's something as simple as meeting up with friends on a weekend and having that on your calendar so that when you have a busy week, um, that you have great things to look forward to that are your life beyond work. Um, so I think getting the essentials down, making sure that you sleep, making sure that you eat and take care of yourself, and then choosing one or two hobbies that will keep you uh, help to kind of like reduce stress and keep you motivated to have some balance. And then with your time off, really scheduling it to have things to look forward to. Um, that's how I approach burnout. And, there are days or weeks that I admittedly feel more tired or stressed than others. But I find that when I'm not doing some of those things that I talked about as well, those are the weeks that I kind of feel things more. I think another way to, approach burnout and to face it head on is also to keep things in a broader perspective of why you're doing your career and the impact that it can have. And um, I've had a couple moments, for example, on shifts where I felt really overwhelmed or really busy and really stressful. And then you take a pause and you're like, wait, as stressful as this day is, we've done some good work today. For this patient, we made a huge difference. For this patient, I had an opportunity to learn something new that's going to translate to better care for my future patients. And it's taking time to pause and put things in perspective and to not get as caught up in the moment. Um, I think that perspective shifting and is really important for kind of navigating those tougher days where you might have a little bit less energy in the tank. But that's where I've kind of learned to dig deep and find the fuel to keep going in some of those tougher days or tougher weeks.
Yeah, and sometimes it just takes a little bit of a perspective shift to change your mindset about something. And that's something that I've been trying to do as well, reframing and putting a twist on something.
Yeah, and I think one way to take less of the onus on yourself to be like, hey, I need to get in the right mindset is really connecting
Mm-hmm.
people with shared experiences. And so I have some of my closest friends are the co-residents that I'm going through residency with, and they know what it's like to work day in day out, the same role that I do, and I've found them to be kind of my greatest source of strength, in times where I really need to talk something out. Um, or times when you need to celebrate something that happens, and reaching out to people that have gone through the same things and remembering that you're not alone, going through your journey in medicine is, I think, the best way to get the support that you need. Something that I think is really great as a growing emphasis in a lot of residency programs is having access to counselors or professionals that can help you navigate crises um, when you're going through residency, whether that's experiencing a personal crisis that translates to your work, or whether that's experiencing difficult events at work or traumatic events at work that you need to debrief. Um, I think a piece of advice that I'd give to both learners, but also it's something that is being more discussed about among co-physicians, is really making sure that you reach out when you do need help and you feel like you can't find that help, um, you know, within a friend or family member, and you need more structured support. Making sure that you use the resources around you and reach out professionally if you need to process something difficult that's happened, or you need to get some counseling. Never being afraid to reach out for help when you need it.
So, next, I want to ask you about communication because you have extensive experience as both a teacher and a medical professional, both of which require strong communication skills. How important are communication and soft skills in medicine? And could you share an example of their impact from your experience?
Yeah, I think communication skills are really what drive the art of medicine. So there's this saying that medicine is both an art and a science, and the science is pretty stone cold and pretty well agreed upon. How to treat um, pathology acutely or to how to manage chronic diseases. What's different is that these we kind of talked about before. Um, the disease process is experienced differently by each person, and you need to really meet patients where they're at and communicate with them in ways that make sense based on their lived experiences. Um, so communication skills, I think, one to one between the doctor and patient. The best thing that I've learned is to listen more to patients. Patients will usually tell you, what's going on and what's wrong. Um, Whether that's through getting a really good history and taking time to listen to them, or whether that's being very observant and doing a good exam and figuring out exactly where their pain is coming from and what might be causing it. Among the healthcare team, communication is so important, especially in an ER where you need to move pretty quickly. For example, in a code setting or in a trauma. And so something that I've seen really emphasized at my hospital, which really helps in those stressful scenarios, is closed loop communication. In a trauma, for example, there can be 20 people in the room, and as the resident, I will be running the trauma survey alongside some support from attending physicians. But there are nurses in the room, there are techs in the room, shooting X-rays, drawing blood, and it could look like chaos to the untrained eye, but it's there's a flow that happens in those situations where if you use really good closed loop communication, you can get things done really efficiently. So, for example, if I call out a verbal order for a medication, um, a nurse would confirm and say and call that back to me with the exact dose and route of administration. um, if we need somebody to head over to pick up blood for a blood transfusion that needs to be done emergently, using closed loop communication with a callback to figure out exactly who's going to be doing that task really helps keep things going. Because you can imagine if there are 20 people in the room all shouting different things, but we didn't take that time to relay and confirm information back and forth, it could really slow things down in terms of patient care. Um, so closed loop communication, and I think also um, making sure that you take time to get to know the people on your team that you're communicating with, to know them by name, to use your downtime to get to know them better, improves those relationships at work, and helps us work better together.
It really is a team sport in medicine.
It is big
Especially in
team sport.
emergency. Yeah.
Yeah.
So, moving on to innovation and technology, two of Oceanside Perspective's core values. If we're talking about these two areas, we have to talk about AI. Just a few days ago, the New York Times published an article called AI Chatbots Defeated Doctors at Diagnosing Illness. Though there's a lot more nuance within the article and the cited study, it was evident that medical education should start teaching doctors how to use AI and maximize its potential while mitigating its risks. What are your thoughts on AI in medicine in general?
Yeah, that's a great question. AI, admittedly, is a field that I don't have as much personal experience with, but I am starting to see its entry into medicine more and more. Um, I've kind of seen it in two ways. One, especially important related to emergency medicine, is in with radiology. We order a lot of CT scans and MRIs, and I think that AI is starting to integrate more into becoming an adjunct to help radiologists detect trends or patterns that might be related to something suspicious, for example, on a CT scan. Um, and it can help to kind of improve efficiency and detection. And that's important for us because we need to kind of read imaging efficiently and to use it to make a clinical decision. And so some of those changes with AI and other fields are going to directly impact our work in emergency medicine. So that's one area that I see kind of a growing emphasis, and I'm excited to kind of learn more about. Another area that I'm starting to hear more about, which would be really exciting for me, is AI and note writing. And so a big kind of reflecting back to what we talked about for burnout before, I think a huge source for a lot of physicians is the paperwork and documentation that you have to do. Um, for me personally, I love talking to patients and having time in the room. Um, One of the job parts of my job that I don't like as much is it's a big documentation burden, and there's a lot of time that's spent kind of note writing that's separated from the clinical encounter or separated from the care that you're delivering. And I've heard about AI being used to help scribe or improve note writing, and then it's not something that's been employed in my hospital setting yet, but I'm hopeful in my career that AI could be used to help us both capture data, whether that's what patients are telling us in a history, or to better capture and integrate data in terms of lab results or imaging results, to really streamline and improve efficiency so that we can give more time back to our patients and give more time back to the patient encounter. Um, I think that's something that I'd be really excited to see. And I think there's also a lot of fears with AI, like in terms of protection of personal health information, and keeping our medical records secure, that I think the leaders in AI will have to navigate. But I'm excited and optimistic to kind of see how it can improve efficiency in medical delivery to give doctors, more time back to their patients.
Yeah, it would be great if AI could be that big source of help in terms of documentation and the aspects of the job that aren't exactly, stimulating or energetic for the physicians and healthcare practitioners. Do you think AI could eventually replace aspects of your job and change the way that you do patient care completely?
That's a great question. I, in terms of the of replacing jobs, I do think that physician roles as they currently are somewhat irreplaceable. Even with radiology, for example, that I was talking about before, um, radiology is not just as simple as um, scanning through an image and finding that one specific spot, or um, finding that needle in the haystack that is going to kind of change the game for the patient. Um, I talk with my radiologists like all the time on the phone. I say, hey, like, I ordered this scan for this reason. I was wondering if you could look in this specific spot. Does anything kind of look suspicious to you here? And sometimes things are not a black and white diagnosis. And the radiologist might say, hey, like, now that you're mentioning it, this little spot has something suspicious. It's not 100% clear exactly what this is, but this patient might need further follow up, or they, given the CT scan, they might need an MRI to better characterize this. And so communication between providers and having people with a foundation of medical knowledge to really interpret data or imaging in the right clinical context and how that relates to the individual patient is really, really important. I think AI might be used to find ways to make jobs more efficient, or make certain tasks more efficient. But ultimately, I think it's going to take individuals with clinical knowledge and with a clinical understanding of how AI can be integrated to really make it successful. Um, so I don't see AI replacing, physician jobs at a large level anytime soon. As technology evolves and accrues more strength, who knows what the answer to that question could be. But I think the important focus right now is if you're pursuing a project in AI or hoping to launch a technology, ensuring that you can really talk to the physicians or the nurses or the paramedics or the techs who will be employing the technology, and in finding ways that you can integrate it successfully with a really good clinical understanding of what's going on. I'm really excited to kind of see AI's influence in medicine, and I think it'll be something throughout my career. It'll be really exciting to kind of track. Um, I don't know. I don't know the answers to what that will look like, but I'm excited to see.
Yeah, I think we're all excited to see how AI evolves and how we can best utilize it to our advantage. So, the last topic is going to be the future of medicine. In your opinion, what is the biggest healthcare challenge that modern people are facing, and what can people do to prevent it?
I think the biggest modern healthcare challenge that we are facing as a society is access to primary care, and it's something that is really important to me in the emergency setting because a lot of what we treat are the manifestations of chronic disease burden. And sometimes, that chronic disease is managed expertly. If somebody has routine access to primary care and they're on all the right preventative medications, and they'll still come in with a heart attack or a stroke, and we know how to kind of acutely manage that. But what I see far too often is that there are individuals that have a diagnosis of a chronic illness and they don't have the access to primary care. They might not have that diagnosis early enough to really be able to navigate that illness course. And in the US, we spend so much on healthcare, but our outcomes are worse than a lot of peer nations. And I think a lot of it comes to um, not having great access to primary care and being able to get in front of illnesses like hypertension, diabetes, heart disease, before they lead to these more serious acute events. And um, it's complex. There's no one right answer for how do we improve primary care delivery. And a lot of it, doesn't come down to the provider themselves. Like primary care physicians, all the ones that I know are amazing and doing incredible work. Um, it's really finding like how do we get patients insured? How do we get them to routinely access care? Whether that's working through language barriers, whether that's working with different degrees of health literacy and understanding of illness. Um, and that comes down to really individualizing care. But I think something I would be excited to see in our country is improving access to primary care, so that we can really address the chronic disease burden that is continuing to claim like a lot of lives in our country. And I'd hope to kind of see some of those trends reversed if we could help detect illness earlier on and really support people to manage chronic disease.
So, what does the future of medicine look like to you?
That's an incredible question. The future of medicine is going to be shaped by the passions that this young generation of physicians brings and the policies that we push for. It's going to be shaped by how we as a society prioritize healthcare, how we fund it, how we continue to address both chronic disease burden, and also how do we continue to innovate within medicine. It's really going to be shaped by where we direct our energy. And that's super exciting, but also there's a lot of unknowns. I am incredibly excited to be a part of that, and to kind of push for change in medicine in whatever like small role I can.
That was a great answer. Thank you. Well, during this conversation, we've reflected on the past with your journey to medicine, the present with your experience as a resident physician, and the future, where healthcare will continue to evolve. As this interview comes to a close, I have one last question. If you could, what's something that you would like to tell your younger self?
I would tell my younger self that it's okay to not know exactly where you're going, and it's okay to not know what tomorrow looks like, but to to shape your next steps around your purpose. Whatever path you're on professionally is the right path. And while you might not know what the stops along the way look like or what the destination looks like, um, if you are finding purpose in each day and taking time to really put things in the right perspective, um, it'll work out.
Thank you for taking the time to do this interview, Dr. McIntyre. I learn so much every time I speak with you, and I wish you all the best with residency and beyond.
Thank you so much for having me.